There's been a big push, particularly in recent years, to get children on ADHD medications. And there's a really important question: when do you pull the trigger? Medications are always going to have the side effects.
And I also think the big question is, do medications make a difference? Do they, do children fare better, and in what way when they're on medications? Do they do better in school? Do they do better socially? Does this help them in the long term? So this is a great study to reference.
So there's a lot written on ADHD, but there's only one really important study answering that question: when to start medications. It was done about 25 years ago. It was funded by the NIH, National Institute of Health, so a non-biased, or about as non-biased as you can get, funding source. It had about 600 kids in it, and it compared outcomes in kids who were given counseling for ADHD with medications. And what it found is that kids did actually behave better with the medications than with the therapy. And for this reason, a lot of pediatricians and doctors have interpreted this study to mean that you should start medications early, and that most kids, young kids, and they were 7 to 10 years old in this study, should be started early and aggressively on medications. The issue is it's nuanced. When you actually looked at it, after 3 years, after the study period had ended, the differences in the outcomes were no different. In fact, kids were doing just as well in school. Behavioral levels had evened out. And so while one might interpret that, yes, I can improve my child's behavior by starting a medication early, the way I would view it, if I had a child in this situation, is actually I won't lose any ground. If I decide to wait and see if the issue improves on its own with some therapy, a less aggressive approach, there's no major risk. At the end of 3 years, I could always start them on a medication. At that point, I won't have lost any ground.
So if I hear what you're saying correctly, it's that if a parent opts to start their child on a medication to help with ADHD symptoms, it may help their symptoms, and that's an okay thing to do. But if you look at it over time, the differences even out. And so if a parent doesn't want to put their child on a medication, that's an okay option as well.
And that is the essence of evidence-based medicine and shared decision-making. There's no right or wrong way to do this. There's pros and cons of each approach. And my job as the doctor is to help a patient understand the pros and cons, let them make a decision that aligns with their values.
And I think this is a really nice example because I have a lot of parents that fall in both categories. Some parents are really unsure if they want to put their kid on a medication. They read the side effect profiles. It makes them nervous. And I think it's nice for parents to know that they don't have to.
That's exactly right. And I think the critique I would have of our healthcare system is there's too many of us who know the headline, medications improve behavior for ADHD, and we push the medication on patients.
It's nice. So it sounds like you give the information to parents, then you respect their ultimate decision.
That's right.